Hello, everyone. I'm Anupama Rao. I'm for the lead for the Volunteer Initiative Program from Praanwellness. Here we have Dr. Tayal. He is the medical doctor of Orion Diagnostics. He is a pioneer in corporate health checkups um, and caters to various corporates. Sorry about this, doctor. I have a whole long list of things that you've told about you. So annual employment checkups and pre-employment checkups also. And he has delivered many lectures on stress. That's what we need. We've invited you for that. We are so happy to have you here at workplace and helped corporates deal with employees better. So thank you, Doctor. Thank you, Dr. Oswin. We welcome you to Pran. And over to you, if you can just introduce yourself a little bit for us.
Yes, good day, Anu. We work, as you said, we work with a lot of corporates for their corporate health checkups and, pre-employment medicals.
Okay.
So we take care of their biochemical parameters, their blood tests, their physicians appointments and stuff like that.
Okay.
So it's a line where we come across some very interesting findings, because we work not with patients. We don't work with patients. We work with people who are perfectly normal.
Okay.
So this is a very preventive kind of health checkup. Okay. So we don't test them because they got an issue. We are testing them if they are going to develop a problem. So it's a preventive kind of a health checkup we do.
Okay.
So in the process, we find out some interesting things. So with one particular company, it is an IT company.
Okay.
So we found the average age group of people who work there are mostly between 25 to 35.
Okay.
And
so that young are the employees at the IT company that you are telling us.
That's okay. Right. That's
okay.
They call bulk of the workforce. So all these people came out with reports of very high liver enzymes.
I see.
So yeah. So I was wondering what is it, so we started taking elaborate history of liquor consumption. So
okay.
The usual thing is, we are wondering whether these people are taking high doses of liquor.
Mm-hmm.
Then I said, most of them don't take liquor at all. Most of them are teetotalers.
Okay.
And then as I was talking to them, I found that their office had put a Coke dispenser near their work. Okay. So every break, every 1 hour, they are going and having Coke and Mirinda and all of that.
Yeah.
So I just company to remove that Coke dispenser.
Okay.
So sure enough, subsequently the findings, the reports that we found, all the liver enzymes are slowly settling down.
Okay.
So yeah, so
That's very interesting to know, because it has become such a cool thing to have these dispensers everywhere. Yeah. And it is easy access, and as you're working and you're feeling that it's a new norm to be having instead of coffee to have a Coke. So these are the newer things. So that's a very interesting reading, Dr. Oswin. Yeah.
Yes. Yeah, in airports also it is easier to access Coke to drinking water these days.
Yeah.
And not perhaps in India, but a lot of other places.
Yes.
These drinks are more available freely than water. Anyway, we'll talk about.
Yeah. So shall I have a few questions lined up, Dr. Oswin. Can I ask those questions for you?
Yeah, sure.
Okay.
Go on.
So first of all, we just want to thank you for coming to Pran and giving us all this very valuable information. It is so needed. We have an employee assistance program that we run from Pran, and we do have these. It will be very interesting to know how you handled it. It will be a good insight. So, first of all, from a doctor's point of view, from a medical point of view, if I have to ask you, what exactly is stress? Because when we as psychologists, when we talk about stress, we will be talking
Yeah,
about emotions, feelings, you know,
yeah,
what are the factors that is affecting these emotions, which is creating a stress, and we usually help them to overcome stress. But you
yeah.
know, for us to know from a doctor that you are, what exactly is stress?
Yeah. So see, anything when a human being is faced with is confronted with a difficult uh, or uh, improbable situation, his response is what we call stress medically. The
Okay.
human's response to a difficult, uh, apparently improbable situation is
Mhm.
called stress.
Okay.
So um, it is such a sweeping scenario today
Mm-hmm.
that WHO has called us the modern day pandemic. Stress is the 21st century's pandemic.
Wow.
So yeah, so
Yes.
it is prevalent widely. I mean, every person would have experienced stress uh, at some point in their life. So that stress. Um
Okay.
so yeah.
Yeah.
So
So if I have to ask
in
you, we are talking about the 21st century. I understand what you're telling. Stress was
yeah.
always there around us. I'm sure our grandparents and great grandparents also had stress.
Oh
But,
yeah,
but
that's an
yeah, please go ahead.
that's an interesting thing, Anu. I mean, I'm sure forefathers would have had stress, but definitely not the kind of stress that we are seeing today, the nature of stress that
True.
we are seeing today.
True.
It's very different from what our 100 years back our ancestors would have seen.
Mm-hmm.
See, the stress they would have seen is probably uh, more of the acute stress.
Okay.
Okay. Today, what is epidemic is distress.
Mm.
Okay. So, um, uh, in acute stress, like if you're going to a trek and suddenly you find yourself in front of a tiger, that is acute stress.
Correct.
Okay.
Correct.
They would have been in many situations like that, our forefathers.
Okay.
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 But today the kind of stress that we are talking about is mostly uh, behavioral. We our relationship with our bosses, our relationship with the people, our spouses, our the people that we interact with, stress in that. Those kind of things, I think, is a modern day uh, feature,
Okay.
because these things our lifestyle is changing so much, and stress comes along with that.
Okay.
Now, gadget, okay, bring along with it a new dimension of stress. We
Mm-hmm.
didn't have gadgets 100 years back. We didn't have targets 100 years back. We
True.
didn't have so many breakdowns of marriages 100 years back. So we are living in an era where stress is totally in a different. The prevalence of stress is at a different dimension.
Okay. That's very elaborate. Thank you, Dr. Oswin. We will go to the next question. We have a
Yeah.
few questions here. So, what are the different type of stress?
So, see, there are different types of stress, but medically, what is relevant to us is whether it's an acute stress or chronic stress. That's all it matters.
Okay.
Okay,
Okay.
acute stress is fine. Everybody have to go through acute stress. I explained that to you
Yeah.
what acute stress is, and it lasts for a very short period,
Mm-hmm.
and therefore it is not physically harmful to the body.
Mm-hmm.
So when you have stress, you have higher levels of cortisol, adrenaline is, you're just pumped up, adrenaline is running about. So if this lasts for a short period, it does not produce any adverse health effects.
Okay.
But at the same hormones running amok for long periods of time, weeks, months, sometimes years, that is going to have an impact on your body. So chronic stress is what we are really worried about. Okay, so chronic stress is what really needs our people's attention. I mean, doctors' attention.
Okay. So I do understand that you run a diagnostic center too. So you must have, seen so many, variations. And as you said, in the IT corridor, you've been, you do so many health checkups and all those things. So would you say that, it is a lot of things are stress related? Do you think some of your readings, when you see the variations, you could say that due to stressful situations, they have come into these physical forms of illness? Would you agree on that? Because that's what mainly everybody is talking about. Everybody says if you take care of your mental health, you will be able to take care of your physical health. So asking you as doctor,
Yeah, I would agree on that, Anu. See, we have some crazy statistics. I mean, nearly 40% of all people, all living human beings, have stress-related medical issues. Okay. Now, I would say 100% of all of us would have experienced stress at some point in our lives. True. But it does not translate into health issues. But 40% of all people, have stress-induced illnesses, stress-induced health issues. Now, US has put up a data saying that 70% of all visits, all doctor visits across the board, all doctor visits are due to stress or stress-related issues. Okay. Now, you might come to a doctor's clinic for blood pressure, hypertension, but it might be stress related. Okay. So if you're talking about in that sense, your diabetes might be stress induced. Okay. Your autoimmune disorder could be stress induced. So 70% of all doctor visits, they're saying that the underlying etiology, origin of the whole thing is from stress. So I share with you one very interesting thing. After so much of scientific advancement and all of that, US in the last 4 or 5 years, they have data which shows that their life expectancy is coming down. Okay. Imagine in an advanced country like the US, life expectancy is coming down. And that thing is because of the increase in the stress indicators. More deaths, everything that is coming out of this cluster of stress issues. That is what is causing. So, I would when you say.
Yeah, that's very interesting to know. Such a vast country, and with all, the information is quite startling. Thank you for that, doctor. So if I can ask you the next question. So tell us something about stress indicators and their relevance.
Stress kind of affects you in a few ways. So this we need to be able to capture that earlier on. Okay. So it is easy to identify the physical changes, the emotional changes. It's quite easy, but the behavioral changes are rather very subtle. So physically, you will have enhanced heart rate, your BP will go up. So if you're experiencing that often, it is easy to identify. Okay. And emotional will be like if you have bouts of anger. I mean, a person normally very calm suddenly is experiencing, his friends and family saying that he's all of a sudden short-tempered. That is an indicator of stress. Okay. And these two are very obvious, but what is not so obvious is behavioral change. So somebody who is being very prompt and very, very punctual and stuff like that, all of a sudden he doesn't take his calls, he doesn't come on time, he's not responsible, he's not responsive. So this is a classic stress manifestation. Okay. When you know that is in handles himself a particular way, and suddenly there is a change in his usual
behavior.
So that is behavioral. Okay. A lot of people don't identify that earlier on, and they suffer. So if there is somebody amidst us who is, not keeping in touch socially, somebody who is all in contact with friends, suddenly is disappearing from, suddenly disappeared. I mean, doesn't keep in touch. Most probably stress induced. So these are the things that we need to monitor. We need to be able to identify, and you need to handle.
So basically, any kind of a new behavior is something that we need to look out for, and that could be related to stress, and those can be indicators what you're telling, doctor. Yeah.
Yes.
Okay. So our next question is the impact of stress on individuals and society. If you can tell us, I do understand it's a very psychological point of a question that I'm asking you, but I would like to just understand from you, because you have given so many lectures, you have gone and given so many trainings for how the managers can handle, or HR can handle their new employees, their stresses and their stress level and all that. So if you can just tell us the impact of stress on individuals and society, what would you say?
Well, the impact is humongous. The loss of productivity. I mean, if you just see the loss of manpower productivity, I'm talking from an organizational perspective.
Okay.
The loss of loss of happiness at a personal level. Okay. At a household level, loss of happiness. At an organization level, loss of manpower. At a societal level, at the level of a country, US has lost $300 billion last year to stress. Okay, so not just in financial terms, it has got implications in financial terms. It has got implications in in the happiness index of nations. Most stressed countries are not high on happiness index. Countries which are not stressed, so there's a direct link to happiness and to stress. So these are all the implications the stress can give.
So doctor, if I have to ask you, as asking you, we know that stress, we know it can affect the heart, it can affect our organs, it can affect our mental state of affairs. All these things do happen when you are under stress. Now,
yes.
In your pathological reading, if you have to tell, what are the first things that you think that a person has to look out when they you really don't know if something is affecting inside my body? I don't know. I know I'm stressed. I can only see my outward thing. So if I have to ask you, is there anything that I have to look out other than the behavior? Is there anything else I have to look out for?
Yeah. So Anupama, it is not stress normally does not give rise to a single biochemical parameter that you can pick up like that.
Okay.
But stress leads to an overall health issue. So it is not something that you can pinpoint and pick up and treat. So it's going to have impact from head to toe. If you are stressed, first of all, your stress hormones are going to be high. It can lead to blood pressure. It can lead to diabetes. And when you know that when these two combine, it can lead to any issue anywhere in the body, from diabetic nephropathy to cardiac issues to everything. So another very, very important thing I would say is stress really impairs your immune machinery. Okay.
Okay.
So now that is something that not talked about. We all talk about BP and all of that, but the impact of stress on your immune mechanism is profound. So you are more susceptible to infection. Okay, you are more susceptible to everything. In fact, today we even think cancer is an immune-mediated illness. Okay, your autoimmune, the host of your autoimmune disorders, your cancers, your arthritis, your blood pressure, everything happens with stress as the origin. Could happen with stress as the origin. So it is the whole thing that could happen, but you cannot really pinpoint one particular thing and pick on that and treat. So you have to look out for the whole thing. But the first thing that you need to identify is the person whether they have an obvious stressor. Patients, when you talk to them, they will give history of some of them will know that there is an obvious stress at workplace, relationship stress, even workplace stress can be a relationship stress.
Yes.
Okay, I would say relationship stress is at the very apex of the pyramid, because most of your stress actually comes from some relationship issue or other. Okay, close to the relationship stress, I would say financial stress.
Yeah.
So
I think with the pandemic, we've really everybody, all of us have been through this financial stress. Yes.
Some form or other. That's right.
Right.
So yeah. So if you look at health, organizational stress, most of the organizational stress is indirectly related to relationship issues, because you have a boss with whom you cannot get along. Right. You have a colleague, a team where you find doing things difficult. It all comes under the gamut of relationship issues. So relationship stress is the most important contributor, I would say, followed by financial stress. Now, financial stress is not just for the poor people. It's not poverty induced.
True.
Financial stress, you can have abundance of resources, but if you're not able to meet deadlines, you're not able to meet, if the supply is less than the demand, however strong are you, leads to stress. So financial stress is something that is prevalent right across sections of society. Relationship. The third would be perhaps health-induced stress. If you have a chronic health problem,
right?
Not just supposing if your child has a health issue,
right?
Okay, it's stress for everybody in the family. So relationships, financial stress, health stress, these are the three most important causes of stress. But then, of course, people sometimes can invent stress also. That is called the invented stress. They have nothing else to worry about. They find something to worry about and stress. But these three are the most contributing.
That's very interesting how you describe the different kinds of stress. I like the last one that you said, invented stress. I think there is the saying that even if you just scratch yourself just too hard, you'll make a wound out of it. So it is just that out of boredom also you can get stressed, right?
Wonderfully said, Nupama. It is very, very true that, for stress can mean different things to different people.
Yeah.
To a housewife, it could be boredom. She has to handle that. So that is stress for her.
Yeah.
Yeah.
True. Thank you for that. So if we do not have much time, but I have one last question for you, Dr. Oswin, before we wrap up. We all speak from our point of view, management of stress. So we talk about it all the time. We talk to our clients about it. We talk to our students about it. We talk to our, counselors about it. We do all that. So if you have to tell us management of stress, coming from a doctor, how would you say that, doctor?
Oh, very, very interestingly, I wouldn't be able to manage stress any differently from how you handle it. And because there is no known medical treatment for stress,
Yeah.
it is not something I can medicate you and I can pull you out of stress. I'd be very happy to do that, but unfortunately, I can't do that. That is nothing that I can do, with a pill. Perhaps the only medication that we can consider is sleeping pill or anxiolytics. All this can reduce the stress to a point, but you need to be able to it has to be handled in person. It's a personal thing. Each person should identify if at all they have stress, they have to identify what's the stressor. So if there is a stressor, you can either avoid the stress or alter your response to the stressor.
Okay.
Now, let's say that your stressor is a person whom you are having a drink socially.
Mm-hmm.
Okay, you can stop having a drink with him socially.
Yeah.
So that stress is gone. Okay.
Right.
So this is avoid. But supposing your stress is your spouse, you cannot avoid it.
Correct.
So you have to alter your response.
Right.
Okay. You have to introspect and what are the points which is causing me stress? How do I react to it?
Right.
It is my reaction causing me stress. Alter your reaction. So whenever it's possible to remove the stressor, remove the stressor.
Right.
If you cannot, if you have to alter your response to the stressor, you have to do that. So,
Right.
so then of course there are measures like very often talked about measures like meditation, yoga.
Sure.
All this would help. So management of stress at the end of the day is up to the person. It's up to the individual. Okay, they need to be aware. They need to be counseled. There is no magic pill, unfortunately. I cannot give like how I can treat you for your diabetes or hypertension. I cannot treat you with medication. This is something that you need to learn to handle. But a lot of life lessons will help. It is at the end of the day, it is a life situation. So to me personally, I would say two things. One is live a life of gratitude. Everybody has got things to be joyful about. Everybody has got things to be sad about. Focus on the joyful part of your life. Be grateful to that. You can either go about your life being grateful or cribbing all the time. So if you're a cribber, the possibility that you will be a stressor. You will end up stressing more. So focus on the things that you have than the things that you don't have. So live a life of gratitude, and when you work, only work. Don't look at the results. There are a lot of times that stress comes because we have expectations, right? It's human to have expectations, but we can work and not. We have only right to work. We have right of action, but we don't have the right of fruit of action. So that's a point that's a philosophy laid out in Bhagavad Gita, I think.
Yeah.
So if you change these behavioral things, if you understand life from a spiritual aspect, I think it is easier to combat stress.
Yeah. Thank you for that, Dr. Oswin. That was really, really nice for you to say focus on the joy instead of focusing on what brings you stress. So basically, like the saying goes, whether the glass is half full or half empty. It's the choice is yours. It's the way you look at it. You look at life the way you perceive it. So if you see it, half full, then there is a positive attitude towards life. So that's what I would say. So yeah, we are coming to the end of the show, Dr. Oswin. We thank you so much for coming to Praanwellness. We are so grateful for your time. Thank you, and it was very informative and very interesting interacting with you. We look forward to interact with you in future too. So once again, thank you, Dr. Oswin.
Thank you so much, Anupama. Thank you for having me.
Yeah.
It has been a pleasure.
Okay. Thank you, and bye-bye.
Bye.